This video is one of a four-part series for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. The series shares the most up-to-date recommendations for preventing respiratory illnesses in adults through vaccination against COVID-19, influenza, respiratory syncytial virus, and pneumococcal disease. In this video, we'll discuss the magnitude of flu and the variability in flu seasons, when to vaccinate your patients, the populations at highest risk for severe disease, the importance of annual influenza vaccination, the types of flu vaccines available, recent flu recommendation updates, flu vaccine effectiveness and safety profiles. We'll close by providing information and resources to help you mount a successful flu vaccine campaign. Each year, influenza infects about 8% of the U.S. population, or about 26.7 million people. Because flu seasons can vary in intensity, the number of infections can range from 9.3 to 41 million. Unsurprisingly, hospitalizations and deaths from flu can also vary significantly by season. Hospitalizations often range anywhere from 100,000 to 710,000, while the number of deaths fluctuates from as low as 4,900 to as high as 51,000 each year. Not only does each flu season vary in intensity, but the timing of each flu season can also change. Since the COVID pandemic, for example, flu season has tended to start earlier than in the past. That being said, vaccination can begin as early as September 1st. This is especially important for those who are at higher risk for more severe illness from flu, including pregnant people, those who are 50 years or older, those with underlying medical conditions such as diabetes and chronic lung or heart disease, those residing in long-term care facilities or in congregate settings, and other populations included in this table. Although technically not a group considered at higher risk, healthcare staff are exposed to illnesses, including respiratory illnesses, more frequently. So it's important to ensure that you and your staff stay up to date on your flu vaccines. Staying up to date on vaccines helps healthcare workers stay healthy so they can be there for their patients. Vaccination of staff also makes it less likely that staff will contribute to the spread of flu within your clinic and your community. To protect your patients, their family members, and the community from unnecessary illness and deaths, annual flu vaccination is critical. In the 2022-2023 season in the U.S., flu vaccination was estimated to prevent 6 million flu-related illnesses, 2.9 million healthcare visits, 65,000 hospitalizations, and 3,700 flu-related deaths. Getting a flu vaccine every year is important for helping decrease the spread of flu. That's why it's recommended for everyone 6 months and older, including young, healthy people. When everyone who is able to gets vaccinated, it makes it less likely that healthy people spread the flu to those who are more vulnerable. There are many different types of flu vaccine, and some can only be given to specific age groups. This table shows the different types of flu vaccines, the route of administration, the manufacturer, and the minimum age for each of the different categories of flu vaccine. Most flu vaccines are given as a single dose intramuscularly. The exception is the live attenuated influenza vaccine, which is given through inhaling the dose in a nasal spray with one spray administered in each nostril. As with the intramuscular vaccines, the live attenuated vaccine must also be updated and administered annually for continued protection. Additionally, 3 specific influenza vaccines are recommended for older adults. These include the adjuvanted inactivated vaccine, the high-dose inactivated vaccine, and the recombinant vaccine. Each of these vaccines is more effective than the standard flu vaccine for older adults. However, if none of these 3 vaccines is available, then any age-appropriate influenza vaccine should be used. Providers should be aware of contraindications and precautions for specific flu vaccines. Some of these have been updated in the past year. For example, all egg-based inactivated influenza vaccines are contraindicated in persons who had a severe allergic reaction, such as anaphylaxis, to a previous dose of any flu vaccine. Another contraindication to be mindful of is that use of cell culture-based vaccines is contraindicated in persons who have had a severe allergic reaction to any previous cell culture-based vaccine. Notably, the live attenuated influenza vaccine has specific contraindications and precautions which providers should review. Specifically, these vaccines are not recommended for adults more than 49 years of age or those who have underlying chronic respiratory conditions like asthma. Providers should also be aware of recent updates for specific flu vaccines and recommendations. For example, in the recent past, all flu vaccines in the U.S. protected against 4 strains of influenza, specifically 2 strains of influenza A and 2 strains of influenza B. This year, all flu vaccines in the U.S. will be trivalent, dropping one of the B strains that has not circulated in the U.S. since March of 2020. So, we've discussed when to vaccinate patients, the types of flu vaccines that are available, and recent updates to flu vaccine recommendations. What about flu vaccine efficacy? You may have had patients opt out of the flu vaccine saying, "It doesn't work," or "It makes me sick," or even, "It gives me the flu." It's important to explain that the flu vaccine isn't perfect, and people who are vaccinated may still get the flu. But for most people who are vaccinated, they are much less likely to develop severe illness. Make sure to emphasize that after receiving the vaccine, they may experience side effects like fever, soreness, or fatigue, but most side effects are mild and go away within a few days. Remind your patients that mild side effects are a good sign that your body is preparing to be able to recognize and fight disease. However, some people make the mistake of thinking that having mild vaccine side effects means they're getting sick with the disease. This is not true. Vaccines do not make you sick with the disease you are getting vaccinated against. If patients ask for more information about flu shot efficacy, let them know that if you get the flu shot, you're about 50% less likely to get sick with the flu. Remind them that getting the vaccine can also reduce the seriousness of illness if they happen to get sick with the flu. Like vaccine efficacy, patients often ask about flu vaccine safety. Here are some specific statements you can use to answer questions, describe the safety monitoring of vaccines in the U.S., to discuss why healthcare providers believe that the benefit of flu vaccines for most people far outweigh any potential side effects. From vaccine testing and monitoring systems in place, including the Vaccine Adverse Events Reporting System, or VAERS, we know that fever, fatigue, muscle ache, and other mild systemic symptoms commonly occur. These symptoms can actually be a good sign that the vaccine is working to stimulate the immune system to provide a strong response to flu. You can share that although it's not often talked about in the media, tribes and Native people have volunteered to help by participating in testing the safety of vaccines. This helps make sure that vaccines are safe for everyone, including Native people. Not only did the flu vaccine and other vaccines go through a good testing process to ensure it's safe for everyone, but it's also very effective at reducing serious illness. Let your patients know that serious reactions to vaccines are extremely rare. To demonstrate just how rare they are, you can share that in a given year, you're more likely to get hit by lightning than to have a severe allergic reaction to any vaccine. Finally, a lot of attention has been focused on learning whether Guillain-Barré syndrome, or GBS, might be associated with having received a flu vaccine. As a provider, you can feel comfortable advising most patients to get the flu vaccine with the knowledge that so far, no clear association of GBS with flu vaccination has been established. However, we do know that GBS can occur following infection with influenza and with other viruses or bacteria. Finally, a successful vaccination campaign relies heavily on quality, culturally resonant materials and messaging. Consider accessing Vaccinated's educational resources, which include colorful handouts, insightful videos, newsletter article templates, an educational flip chart, presentations for community outreach, and eye-catching social media posts. Vaccinated's materials are designed to help you engage with your community and talk to your patients about vaccines. To access Vaccinated materials, visit IndianCountryEcho.org/Vaccinated. If you would like to know more, or if you have a question, check out the Indian Country Echo website, IndianCountryEcho.org. Here you can ask a clinical question, and then Indian Country Echo's clinical team will answer your questions and provide consultation. They will respond within 6 hours during the business day. Remember, every vaccine you give saves lives.